Welcome back to the Humble Healer podcast. And thank you for taking your time to tune in. Today, I'm going to talk about something that is a rare occurrence, but can potentially happen to anyone, any air travelers in particular. So, this is the topic is in-flight medical emergency. So, if you have any medical background knowledge, you can volunteer to help out. And it's good to be able to see if you can contribute to perhaps saving a life or just calm situation down and, or provide good, explanation for the other passengers to calm everybody down. So there are many roles you can play, but in any ways, is to be able to help can, bring a lot of joy and reward to be to to contribute to helping being fellow passengers. So basic information: 2.8 million passengers in and out of the U.S. in 2018, and there's a rate of about 24 to 130 medical emergencies per 1 million passengers, and 65 to 70% of these cases are managed by the cabin crew without assistance of healthcare professional, and crew members are trained in PCR, CPR, and use life-saving equipment such as AEDs, which is like defibrillators for people that have cardiac arrest. And if asked for assistance, a medical professional should ask if he or she is suitable to render aid. Make sure that they're not physically and mentally incapacitated. So the cabin is a loud and austere environment. So maybe too loud to use a stethoscope. And the physicians assist in about half of medical emergencies, and 20% with our nurses, and 4% by EMS personnel. Medical professionals are protected from liability by Aviation Medical Assistance Act of 1998, unless there is gross negligence or willful misconduct. A legal obligation to assist in Europe and Australia, but not in the US and Canada. So, how do you approach if there is an in flight medical emergency? Identify yourself and state your medical qualifications. Hi, my name is Dr. So and so. It's my training, and I think I can provide some assistance to in this critical situations or in medical emergencies. And some airlines may ask for proof of credentials. So once that's done, try to get a complete history and identify the high risk symptoms such as chest pain, shortness of breath, any numbness or weakness, stroke symptoms basically, and want to see what we are dealing with. Is it a cardiac emergency? Is that a neuro or brain emergency? Is it a lung emergencies and so on? So once you have or may not have a clinical picture of what's going on, then get the vital signs. It's always important. The vital signs are vital. So see what they are running at. Are they hypoxic? Are they running high heart rate or low heart rate? Blood pressure is maintained and so on. And after, your evaluation, and if you need more information, let the staff know, but inform the cabin crew of your impression and recommendation. And what happens then is they will initiate a ground-based consultation, if not already initiated by the flight crew. So the airline may require ground-based consultation before opening the medical kit. So, and the consultation will talk about who is the ground crew that will help the air cabin members or whoever that helping to make decisions. So aircraft diversion requires the assistance of ground-based medical consultants and pilot. And also as an assistant, you may provide treatment such as oxygen or AED indicated depending on the clinical pictures of the passengers. And you document the clinical presentation and the care rendered. And key is that do not attempt to practice beyond your level of expertise, but remember, your assistance is valuable and better than that of non-medical professional. So good to know what the airline have for onboard medical equipment. So the Federal Aviation Agency, FAA, mandated that certain medical supplies are available on board U.S. commercial aircraft, and typical kit include an AED defibrillator, which is super important in cardiac arrest, and stethoscopes, syringes, tourniquet, sphygmomanometer, which is what we use to take blood pressure, oral airways for those that have collapsed airways and have respiratory issues, failure, needles, IV line kits, CPR mask so that you can do CPR with, mouth to mouth rescue, and So basically, if you learn basic life support, you'll be able to have a lot to work with here. And then you can also do some more than basic life support. If you have advanced cardiac life support, you'll be able to use some of the equipment on board too. They have medications that typically include antihistamines for allergy, atropine for low heart rate, aspirin for those with cardiac arrest, and bronchodilator to help those with severe asthma attack, and dextrose with this sugar solution, EpiPen for anaphylaxis or severe or life-threatening allergic reaction, and injectable lidocaine for any sort of traumatic injuries for numbing, sublingual nitro for those with chest pain or cardiac issue, normal saline for IV fluid, analgesics, typically non-narcotics. So some medical or professional organization have requested addition of naloxone, a post-ox. Naloxone makes sense because of the opioid overdose would make sense. And then oxygen for those with hypoxia or low oxygen level, antiemetics for those with nausea, and other sedatives. So who makes up of the ground-based medical resources? These are typically emergency medicine boarded physicians with additional training in aviation, and also telemedicine usually staff ground-based groups so they can help out. And so aircraft diversion, unfortunately, 47% in-flight medical emergency require aircraft diversions. So these are just in-flight medical emergency, not just all flights. That would be not good. And the most common cause are cardiac arrest in 58%, cardiac symptoms in 18.4%, OB related. People give birth. Unfortunately, there is a piece on emergency medicine review and perspective where an emergency physician had to deliver a baby on board, and it went well. Typically, patient from outside the country, and also possible stroke, 16.4%. OB related is 18%. And in specific condition, so people pass out or near pass out are the most common category, and this in comprises of about 33% of all causes. And so in these patients, initial vital sign may show severe low heart rate, which is common. So when people passed out, everything shut down. So blood pressure will be low, heart rate will be low. So don't panic. Eventually, they will if once they regain consciousness, everything will pick up. And so a lot of time it's better to observe patients or passengers to see this. You see the color back in their on their facial expression. Then you can get their information, the vital signs. And the patient may appear also diaphoretic, meaning that they have diffuse sweatings and pale, which is very typical in for people with what we call a benign cause of passing out or vasovagal. Keep the patient in Trendelenburg, which is when you put the head down and the leg up. So that way they get more oxygen in their brain to allow them to recover faster, and also move into an aisle or galleys with legs elevated, like we talked about at Trendelenburg. And if needed, you can use oxygen. And then also important to check blood sugar, which is also not uncommon cause of people passing out. If they have not recovered within 15 minutes, then obtain ground-based support and consider aircraft diversions, because this could be heart attack, lung clot, severe lung clot, arrhythmia, or abnormal rhythm, low oxygen level, hypoxia. And if they have low blood pressure that's persistent, then we need to give them some fluid also. So that's general approach to people that pass out or near passing out. One third of all the medical emergencies, pretty common. So get the information, support, and most of the time they will recover. Shortness of breath comprises of about 10% of in-flight medical emergency. So when you have reduced cabin pressure at a high altitude, it can cause reduced blood oxygen pressure to about 90%. So patients with known hypoxemia are advised to travel with oxygen. So obtain an oxygen post-ox in these patients who has shortness of breath, and provide supplemental oxygen if they have less than 95% of oxygen on level on the post-ops. And you may not be able to reverse a shortness of breath if patient normally need 4 liters of supplemental oxygen. So aircraft diversion may be required in that case. And if they have bronchodilators with these asthma medications, or people with bronchospasm or asthma attack, you can certainly try it to see if that helps bringing up the oxygen level. It's easy fix if that were the case. So shortness of breath. And then chest pain, 7% of the in-flight medical emergency get history and physical, just like all the other complaints. And if suspected an ongoing heart attack, needs to provide appropriate treatment. And if you are trained in the ACLS protocol, advanced cardiac life support, make sure you apply that knowledge to help these patients start the IED fast. Get them in there. If you diagnose them or you think they have a cardiac arrest, get the AED in there and shock them fast. Not epinephrine, just shock them and CPR, shock them CPR. And then you have time to get epinephrine and so on. But those are the most helpful treatment intervention to allow for maximal neurological intact survival. So remember, just if you remember anything, just shock them and CPR, chest compression, shock, chest compression every 2 minutes. Shock them again. And for brain emergency, such as stroke and seizure, is up to 5.5%. Also follow up the ACLS protocol for stroke. And also people with low oxygen level can have lower seizure threshold. So make sure you pay attention to that. And if they always have seizures, you have trouble and it doesn't stop on its own. And if the flight crew has oral benzodiazepine like diazepam or midazolam, give them for the seizure control and diversion for those failing to recover from seizures. Traumatic injury can be 5%. History of blood thinner or anticoagulation is important in these passenger with head injuries. So make sure that you check and get the medication list and history, and then make sure that they don't have any acute neural finding, such as facial weakness, limb weakness on one side, things like that. Psychiatric symptoms, 3%. Make sure you rule out, organic causes, which is something that may not be easy. Organic cause mean that it's not a mental health issues, but it could be caused by um, say for example, people with low blood sugar can be sometimes be confused, disoriented, and people may think that they have delusional disorders, hallucination, things like that. Make sure that those are ruled out first. Make sure the vital signs are okay, and always start with verbal de-escalation first, and then airline security will take over after. Allergic reaction, and epi. The Benadryl and steroid, they don't save lives, but the epi, get them on board. And just remember that they don't last over 15 minutes or so typically. So if the symptoms return after that, and especially after you give two epi and they still have symptoms, then you should divert aircraft so that they can get continuous running epi intravenous treatment and also observe in the intensive care unit. OB is 1% in-flight medical emergency, but third on the list for diversion and second on the list for hospital admission. Obtain gestational age, pregnancy complications, abdominal pain and contraction qualifies for diversion. Obtain vital sign, assess for any vaginal bleeding and implantation over 20 weeks of gestation with ongoing severe vaginal bleeding and abdominal pain, consider diversion, since there may be a chance of being able to save the fetus in a certain area of the United States up to 20 weeks now, not 24 like before. And need to rule out active labor, pre-eclampsia, and an abruption when there's rupture of the placenta, which is not a fun thing to deal with. So here's some information about in-flight medical emergency. I hope you find them helpful, especially those with medical background. See if you can, don't be shy. Whatever you can do to help the staff, cabin crew will be helpful. And if they are okay, they can just tell you that, that's okay. And, they're all set. So, but you have some training, but especially basic life support, advanced cardiac life support, or neonatal, or pediatric, advanced cardiac life support, then raise your hand and see what you can do to help. You know more than you think you do. That's what my feeling is. So leave me any feedback. Let me know if you have ever been involved in any of these in-flight medical emergency and what happened and did you volunteer and so on. And take care, everyone.